Internal iliac artery. This pelvic vessel is the cause of massive life-threatening pelvic bleeding. Why is this artery so dangerous? First, it's short, only 3 to 4 centimeters long. Second, it lies deep inside the pelvis, making it hard to access. And third, it supplies the pelvic viscera. These visceral arteries have high blood flow and low resistance, so bleeding from them can be very severe. Let's look at the course. The artery arises at the level of L5-S1, just in front of the sacroiliac joint. It then runs inframedially and ends near the upper margin of the greater sciatic foramen at the pelvic brim. Here, it divides into anterior and posterior divisions. Relations are key for surgeons. Anteriorly, ureter, ovary and fimbriated end of the fallopian tube. Posteriorly, internal iliac vein, lumbosacral trunk and sacroiliac joint. Medially, terminal ilium on the right and sigmoid colon on the left. Laterally, external iliac vein and obturator nerve. Surgeons identify the artery by looking at its relation to the vein and ureter. Here's the bigger picture. Blood flows from the abdominal aorta into the common iliac artery, which then divides into the external iliac artery and the internal iliac artery. The internal iliac is the main blood supply of the pelvis. Its anterior division supplies pelvic organs, while the posterior division supplies the pelvic wall and gluteal region. The anterior division branches are very important. There are 8 key branches that you should remember. 1. Umbilical artery or superior vesical arteries to the urinary bladder. 2. Inferior vesical artery in males supplies the bladder base, prostate, seminal vesicles. In females it is replaced by the vaginal artery. 3. Vaginal artery in females supplies the vagina, bladder base, cervix. 4. Uterine artery, an additional branch in females, crosses over the ureter. Remember, water under the bridge supplies uterus and cervix. 5. Middle rectal artery supplies the middle rectum and also prostate or vagina. 6. Obturator artery courses through the obturator canal, supplies gluteal and medial thigh muscles. Surgeons need to aware of the corona mortis variant. 7. Internal pudendal artery passes through greater and lesser sciatic foramina, supplies perineum and external genitalia. 8. Inferior gluteal artery exits below piriformis, supplies gluteus maximus. Posterior division branches include 1. Iliolumbar artery. Lumbar branch supplies psoas major and quadratus lumborum, anastomose with the 4th lumbar artery, and gives a spinal branch to the cauda equina. Iliac branch supplies iliacus muscle. 2. Lateral sacral arteries, usually 2 in number, supply sacrum, contents of the sacral canal, sacral nerves and meninges, and skin and muscles dorsal to the sacrum. 3. Superior gluteal artery supplies piriformis, obturator internus, nutrient artery to the ilium, gluteus maximus, medius and minimus, and the hip joint. Clinically, the internal iliac artery is commonly injured in pelvic fractures, major gynecologic surgery, and severe pelvic trauma. Here's the surgical pearl. Internal iliac ligation saves lives. Pelvic trauma or surgery can injure the internal iliac, leading to massive concealed hemorrhage. The anterior division is usually the source. Ligation or embolization reduces pulse pressure, promotes clot formation, and preserves tissue. Follow and subscribe for daily surgical insights.